Stakeholders in the health sector in Nigeria have decried the inadequate funding of the sector by government as reflected in the yearly budget allocation, which is yet to meet the 15% target. Nigeria's health sector has suffered from acute underfunding for decades, with the recent exclusion of the health sector in the country's 2023 supplementary budget raising fresh concerns. News Central's Adesewa Odusoga reports.
The 2023 budget of 21.83 trillion naira is considered Nigeria's largest budget in history. However, a review of the budgetary allocation to the health sector in the last 4 years sustains the country's refusal to meet the commitment made by African leaders under the Abuja Declaration in 2001 to allocate at least 15% of their annual spending to the sector.
The import of that defective or under appropriation ranges from inability of our populace or teeming populace to access quality care. Sometimes consumables as little as methylated spirit is in short supply in a hospital.
These funds are meant to be used for building infrastructures, investing in research and development, also welfare of healthcare workers, which is one of the big reasons why people are leaving.
Again, the health sector was excluded in the fresh supplementary budget of 2.17 trillion naira signed into law by President Bola Tinubu to fund defense and security, as well as the provision of welfare packages for poor Nigerians. The health sector is currently battling a massive exodus of its personnel to European countries due to poor remuneration and welfare.
Only few centers can actually boast that they have a functioning CT and MRI. Now, emphasis on functioning, because a lot of centers might have CT scans and MRI, but they are not functional because of poor maintenance over the years. Public and the top-notch government facilities even refer patients to private facilities because they don't have this equipment, which is very, very sad.
The Nigerian Medical Association in 2022 report alleged that Nigeria currently operates on 1 doctor to 10,000 patient ratio, putting more pressure on its personnel who are left to work with inadequate medical facilities.
This element of patriotism should be, reciprocated by providing a conducive working environment and working conditions that will engender maximal and optimal productivity on the part of those who have decided to stay back.
In 2021, the World Health Organization ranked Nigeria's healthcare system as the 4th worst in the world. The country is also ranked number 4 behind Chad for countries with the highest maternal mortality rate at 814 deaths by 100,000 live births. This calls for an urgent intervention from the government in the areas of funding and investment. Adesewa Odusoga reporting for News Central.